let's talk about some restricted drug programs. Now, whenever you're dispensing most medications, you'll get the prescription and you'll dispense it accordingly. But on some medications, because of maybe a public safety issue or maybe any other kind of side effect that we're concerned about, there may be some extra red tape that you, the technician, will need to take care of before you can dispense the medication. In this lecture, we're going to learn about why is there even a need to have programs with restricted access to certain medications. We're also going to cover 3 example medications that have these restricted programs, and those are thalidomide, isotretinoin, and clozapine. We'll cover those 3, but there are certainly more, which we'll have a link to the side here that will let you see the list in its entirety. So why even have restriction? Well, first of all, it may be a safety issue, as we'll talk about whenever I get to a few of the example medications, that sometimes there is an issue of just safety with taking the medication. Also, abuse. If I'm concerned about the drug getting out into the streets, getting out and being sold and then used illegitimately. And then also the concerns about adverse effects. That gets kind of into the safety bullet that we have before, but sometimes it's safety as well as just adverse effects, just kind of balled into one. And then lastly, it's usually a joint effort between the prescription drug manufacturers and the FDA that are putting these programs together. Many of these programs are collectively known as the REMS program, or the Risk Evaluation and Mitigation Strategy. In these programs, this ensures that the benefits of the drug actually outweigh the risks. In the pregnancy category lecture, we discussed how sometimes you'll have to look at the needs of the mother, the medical needs of the mother, versus the side effects either to the baby or to the mother, and then determine whether that'll outweigh the risks or not. And the same thing has to be done here in some of these programs. There's lots of medications that'll utilize this, and sometimes one will pop into your pharmacy that you're not even aware of. Many times your pharmacy will have to register to be able to even dispense certain medications. So you as a technician will want to keep your eyes open for that if your pharmacy isn't registered to dispense that medication. There are many similar medications that will share REMS. In other words, many of the pain medications that are very strong and have a very big chance for abuse share some of the same exact protocols from drug to drug. So our first example is going to be thalidomide. Thalidomide is the classic example of one of the biggest disasters in pharmacy history. It was licensed in the UK in 1958, and it's used for the treatment of morning sickness, or at least that's what it was used for in the UK. The issue was it actually caused baby deformation. Young children were being born without limbs, without arms. And this was a problem, obviously. We're giving it to mothers to trying to defeat the morning sickness side effect of pregnancy, and it's turning out actually harm was done to the baby. So this is a reason to where we want to make sure that pregnant women weren't getting thalidomide. Well, it's actually still approved in the US by the FDA. A couple of indications is it can be used for Hansen's disease, which you might have heard called leprosy, or also for multiple myeloma. The program that's used to help kind of mitigate this problem is the STEPS program, and that stands for the System for Thalidomide Education and Prescribing Safety. It educates patients about the dangers of the drug, and the technician and the pharmacist are going to have some responsibilities to be able to make sure that the checkpoints have been done to make sure that the parts of the STEPS program have been performed. The next medication I want to cover is one you may be a little bit more familiar with, and that is Accutane, or the generic name of isotretinoin. It's a treatment for acne, and many of you may know it because you may have actually taken it yourself. Severe birth defects can result from Accutane as well. And to do this, they'll try to make sure that there are a few different barriers to getting pregnant. First of all, there's the iPledge program. The iPledge program is what needs to be gone through for every individual, particularly women that are going to go through this program. The prescriber must register with the iPledge program, pharmacies must register, a patient must register, and lastly, even the distributor must register with the iPledge program. The prescription window is 7 days and starts on the day that the urine or blood sample is taken for a pregnancy test. So we have 7 days to fill it. The date is counted as day 1. Remember, it starts the day that the urine or blood sample is taken for a pregnancy test. Why are they doing this? They want to make sure that a woman that is prescribed Accutane is not pregnant. Also, Usually the patient will have to sign something stating that they will use multiple methods of birth control, and that's always kind of a awkward situation for a woman that's just looking to clear up her face. The last medication that I want to discuss is an antipsychotic medication known as Clozaril, or you may hear it called clozapine. It has a very bad side effect in which it'll make the defenses of the body go away. It'll make the white blood cells get very, very low in the body. White blood cells are used to fight infection, and if you don't have any or many white blood cells, you won't be able to fight an infection very well. This could cause very bad effects up to and including death. Around 1% of the patients on this medication can actually have this, and it's got a nice big term called agranulocytosis. I seriously doubt you'll have to know the word agranulocytosis. Nonetheless, it's always good to be educated, and that simply means that lowered white blood cell count that you can see. Usage of the medication requires white blood cell monitoring. This is known as the CARE system in the Clozaril brand name medication. A pharmacy must verify the white blood cell counts and another acronym here, ANC, which is the absolute neutrophil count. They're going to have to make sure that those lab values are within normal limits. And the lab that the patient goes to will actually send the values to the pharmacy. And then the pharmacist or the pharmacy technician will need to type in those values into the website that the brand name or the generic name manufacturer uses. Now, this is something that is very important because we obviously don't want the patient to have deal with this agranulocytosis, low white blood cell count. One thing I do want to mention is while at first patients may have to do it very often, up to and including every month, eventually through the CARE system, they don't have to have their blood drawn quite as often. So that's just a few examples of some medications that can be in a mitigation strategy or a restricted drug program. The three I mentioned are just a small slice of the link that you can check out, and make sure you do check it out. It'll have several different medications that take this extra bit of paperwork. Just today I had a medication called Ticacin that I dispensed that required me to put a special stamp on the prescription as well as verify that the prescriber was registered in that particular program. So there's several different programs. Take a look at them and just be aware of them. The three that I put on there are great examples to know. Any of them can be fair game, but certainly these three that I put on the example here are ones that even the PTCB had put on their information sheet. So take a look at those, and then let's move on to the next lecture.